Now reverting your attention to medical condition. Obstetric fistula occurs when a baby gets stuck during the childbirth, causing a severe birth injury. This condition creates a hole between the birth canal and the bladder or rectum, leading to uncontrollable leakages of urine and feces, leaving affected women in distress. Lutheran Medical Centre, in collaboration with the government, is dedicating efforts to providing surgical treatment to obstetric fistula patients in the country. SSBC's Leila Osman reports.
The agony of women living with fistula in South Sudan, restoring dignity and hope to the women. Obstetric fistula is a devastating childbirth injury that occurs when prolonged obstructed labor creates a hole between the birth canal and the bladder or rectum. The result is a continuous uncontrollable leakage of urine or feces, a condition that not only damages a woman's body but also destroys her social life, dignity, and sense of self-worth. Fistula causes deep physical and emotional trauma, often pushing women into isolation, poverty, and despair. In South Sudan, an estimated 60,000 women are currently living with this condition. Yet fewer than 1,000 have received surgical repair. According to the Ministry of Health, most of these women are young, many still teenagers, and almost all come from rural, impoverished areas with limited access to health care. The Lutheran Medical Centre, opened in 2018, is one amongst dedicated facilities in South Sudan, providing surgical treatment for obstetric fistula. It has successfully operated on hundreds of women from across the country. However, challenges remain. Dr. Ashai, a lead physician at the center, reveals a disturbing trend.
Previous operations, maybe the operation that was done before wasn't done properly, or maybe the operative care wasn't correct, or maybe when the patient was discharged was not told what to do, or the time she should come back to the follow-up in the next scan. So there are a lot of factors go into the healing of patients. So I've seen so many patients, and most of the patients that I've seen, the outcome are those who have been operated 5-6 times. And in the theater also, when we are operating, I can see that very hard to get to the tissue. It's horrible. So
90% of the women arrive alone, abandoned or unaccompanied by their husbands, which is concerning according to Dr. Ashai.
In the time I've been working here and with the patient I have seen, and if you go with me later to the ward, you will see that none of our patients, almost 0% of them, have their husband around. So, and most of them are abandoned or divorced if they were married by their husbands.
One such patient is Lona Nini, who traveled from Terikika, once a vibrant member of her community. Nini became socially withdrawn and deeply ashamed due to her condition. She recalls how a complicated labor left her torn and broken both physically and emotionally.
In my stay, I don't go to public. I stay at home alone. Even if people are gathered, I don't go join them. I feel ashamed. If I am moving the old road, what? I fear other one.
A 41-year-old mother of 4, Sophie Valentino from Capoeira, who lived with the condition for 17 years, shares her emotional burden. The condition began after the birth of her first child. She describes how people's harsh words forced her into constant isolation.
Because the sickness can embarrass, and I'm always uncomfortable. Even at home, in the public, at the workplace, I'm always suspicious. The condition I'm facing.
Yet, there are signs of hope and compassion. Luis Massimo, a caretaker from Shukodom in eastern Equatoria State, has accompanied several women to the center, some of whom were abandoned by their own families, according to Luis.
Human being, like a man, should at least not blame these women, and I think we also have to give them courage, at least encourage them. Sometimes this surgery cannot go well for the first time. Second time, they should also, we have to tell them so that they have to come for the second or third time.
A midwife at the Lutheran Medical Centre, Linda John, shares a key lesson. Discouraging home birth, most fistula cases could be prevented through skilled care and timely medical intervention.
In case of delivery, we do aware. You have to deliver in the hospital. Hospital delivery is the best, and we discourage home deliveries. And some of the cultural beliefs, we do discourage some of those things. Then we encourage them to come and to do antenatal care, to follow in the hospital, to deliver in the hospital, to get safe delivery and safe baby also.
From a broader societal perspective, Reverend Benayum Kasahun emphasizes that women with fistula are among the most marginalized groups. He calls for collective government action and investment in maternal health.
No human being has to go through this circumstance. I think government, local government, national government, communities, churches must collaborate to address those issues. Addressing early marriage, that is one area, and working on not only early marriage, also we need more clinics where women can deliver in a clean, safe environment.
The scale of the crisis is daunting. A study found that 41.3% of fistula cases in South Sudan occurred during adolescence, pointing to a critical need for early intervention and access to reproductive health education. As the suffering continues quietly in remote corners of the country, the call is growing louder. These women must not be forgotten. With more support, awareness, and political will, fistula can be both treated and prevented. Leila.
Thank you, Leila Osman, for that great report.